you, Dave. All right, so we'll get started. So welcome everyone to this spotlight session to REB or not to REB. That is the question. How to work with data and analytic services. Let us count the ways. Thank you again for joining us today. Before we launch into this, I have a few housekeeping notes that you may have heard already in the previous sessions. The first is that closed captioning is enabled for all of these sessions, and also that this session is live and will be recorded. Video recordings will be available after the conference. We do really hope you get involved in the conversation. So as we move through the different presentations, please keep track of your questions, comments, and we will be using the chat feature in the Zoom at the end of the presentations. So let's get right into it. So actually, first, I'd like to get a sense of maybe where everyone is today in a certain way. I'm just going to ask a quick question of all the participants, a quick little poll. Oh, I think it should be the first one, the icebreaker one, please. Getting the right one up. Now you know what the other questions are. All right. So how's the weather where I am today? Similar to Michael, I'm actually situated in Toronto, Ontario. So for me, it is sunny today. See if we can see the poll results. But as you're filling this in, thank you very much for doing this. And I'm going to launch right into the rest of the presentation. So next slide, please. So we have a number of presenters today, and I don't want you to get phased or daunted. Oh, just the previous one, please, with the presenters. Thank you. So today we have a number of speakers that are going to chat to you and just give you a little bit more insight about some of the different services that we offer. Oh, thank you. Oh, yay, it's sunny for most people. Oh no, someone works in a windowless room. I was afraid of that. To the individuals that are in the windowless room, I hope that, you eventually get out of your windowless room, get to enjoy some of the outside. But mostly sunny, that's nice, with a little bit of rain. All right, thanks everyone. All right, so for the presenters today, we have Diana, Stefana, Carissa, Michael, and Natalie. I am Minnie, and I am playing the role of moderator with a little bit of presentation as well. So as we move through today, again, we really, really welcome all your questions. The purpose is not that we expect that you're going to remember everything, know everything, but that you hopefully will have enough information that you can contact us further or ask further questions. So next slide, please. So quick agenda first, just to kind of anchor us in what we're going to be talking about. I'll be speaking a little bit about overview of just ICS and also data and analytic services. The next section, we're going to move into some of our different portfolios in a little bit more detail. And then after that, Natalie's going to give a really great insight on what it is like to work with an actual analyst and epidemiologist in data and analytic services. And last but certainly not least, by any stretch of the imagination, Michael Smith will be speaking to privacy and legal obligations. So at this point, if I can get the second poll up, or I guess poll number 1, because given this little bit of information, I am just curious to know, what do I primarily hope to get out of today's session? So what is a day in the life like as an analyst epidemiologist? Or I would like to better understand privacy and legal obligations. I would like to learn more about how to work with data and analytic services. And I think I signed into the wrong session and it's too awkward to just leave now. So hopefully most of you are not picking the last option. If you are and decide to stay, we hope to make your time worthwhile. So I'll just let people fill in the poll segments. And hopefully that'll pop up with the results. And for those who do have questions in the chat, if it's easier for you to submit your questions as we're speaking through the different segments, please feel free to do so. Or you're welcome to save them to the end. Okay. All right. Oh no, someone signed in the wrong session. All right, this is great. Okay, awesome. This is super, super helpful. That's wonderful. Okay, next slide, please. All right, so a little bit of history. Here I'm going to move through the slides relatively quickly. This information and a lot of the graphics are available on our public website as well, but I just want to set the stage. Next slide, please. So ICS was founded in 1992, and really it was created as an independent, not-for-profit analytics and research institute. We have great partnerships across organizations, with organizations across Ontario and Canada, so that we are able to receive health records of Ontarians to be used for analytics and research. While the original focus of our institution was really hospital-based services way back in the 1990s, we've really expanded quite a lot over the years to include community-based health services, health policy, Indigenous health, social determinants of health, and data science. Next slide, please. Oh, next slide, please. Thank you. So we kind of cover 800 research data and clinical experts spanning a network of 8 research programs and 7 sites across Ontario. We are governed by a volunteer board of directors and guided by our scientific advisory committee and a public advisory council. As a prescribed entity under provincial privacy legislation, we are a trusted steward of health records over 20 million Ontarians, that's a lot, including past and present health card holders. You'll notice that most of our sites are in Southern Ontario, with one that is in our ICS North, which is actually situated in Sudbury. Next slide, please. Our mission is to translate data into trusted evidence that makes policy and healthcare better and people healthier, guided by our vision of improving health and healthcare for everyone through world-leading research and analytics. And we conduct our work with the underpinning of our values of excellence, integrity, relevance, collaboration, and respect. Next slide, please. When I mentioned before about our 20 billion life histories, you've naturally probably kind of clued into the fact that we hold a fair amount of data, or stewards of a fair amount of data. So this graphic is really just to demonstrate that there are some broad categories that a lot of our data falls into. This is by no means an exhaustive list. Next slide, please. And what we're able to do is we're able to link our data sets using a unique algorithm based on the Ontario health card number. And what we can do is follow someone's trajectory through the healthcare system using a number of linkages with these different data sets. So it really presents a pretty comprehensive picture for those insured with the Ontario health card system, or the Ontario health system, of someone's interactions with the hospital, with the doctor, potentially certain prescriptions. And all of this can be found through our ICS data dictionary, which is available online publicly. Next slide, please. And once you kind of get a sense of all the different data sets, when you come to work with us, what we can provide and what our analytics staff do is work with a linked data set to provide a number of different deliverables and outputs. Next slide, please. So I'm going to launch again into a little bit of an overview of the portfolios, but first there's a little bit, oh, not yet, sorry, the poll comes after this. Next slide, please. I'm just going to talk a little bit about our timeline and what we offer. So we have an applied health research question. We refer to it as an ARC, and this support really is for policymakers and providers for research evidence to inform planning, policy, and program development that will benefit the Ontario healthcare system. Next slide, please. We also have support for public sector researchers. And here, our researchers may get access to line level data and also analytic services. If it is line level data that is of interest, we have an ICS data and analytic virtual environment that was launched in 2014, along with our support for these types of researchers. Next slide, please. In 2016, we offered our support, or started offering support to private sector clients. And here we have analytic services that are available to private sector clients. Next slide, please. In 2017, an additional service was offered, which is called third-party research, cohort, and longitudinal follow-up services. You will definitely learn more about this later on, as well as the other portfolios. Next slide, please. And in 2021, we were really pleased to be able to offer access to our line level data through our data safe haven. So this was really geared towards researchers that required a higher performance computing environment. So that was done in 2021. Next slide, please. So I just wanted to provide a bit of a timeline, just to give you a sense of how we've evolved over the past 10 years-ish. And one little nuance that I will mention at this point is that the ARC program, Applied Health Research Program, looks like it's way more than 10 years. And that's because that program actually was started with the ministry prior to the inception of the official Data and Analytic Services department at ICS. But we manage and facilitate those requests since Data and Analytic Services was brought on as a department. All right, so just to see if people are still paying attention, another question before we take a deeper dive into the different portfolios. So, I wonder if this is what I think I need the question before this, please. So maybe poll number 2. All right, so I know I breezed through this very quickly and it was very fast, but just based on the little tidbits of information I provided, what service do I think I might be interested in? So there's the applied health research question, there's third-party research, publicly funded research, third-party research, privately funded research, and the cohort and longitudinal follow-up services. Let's give people a few minutes, or not minutes, a few seconds to answer those questions and see how they'll sort of guide the rest of our presentations. All righty. Okay, ooh, okay. Applied health research question in the running for now. Awesome, this is great. All right, so without further ado, I'm gonna pass it over to Diana, who's gonna talk to you a little bit more about our applied health research question program. Thanks, Diana.
Thanks, Minnie. Hi, everyone. My name is Diana Un, and I'm the Applied Health Research Question Project Manager, or ARC-PM for short. And I'll be sharing a brief overview of the ARC portfolio at ICS. We can move on to the next slide, please. And the next one. So the Applied Health Research Question Program, or ARC program, is a ministry-funded initiative that makes it possible for organizations to overcome financial or resource barriers in obtaining customized research evidence to inform decision-making around improving Ontario's health system. The ministry defines ARCs as a question posed by a health system policymaker or provider, also referred to as knowledge users or KUs, in order to obtain research evidence to inform planning, policy, and program development that will benefit Ontario's health system. Next, I'll highlight the main criteria that we use to assess ARC submissions. Each ARC that is submitted is adjudicated or decided on by our 10-member committee on a monthly basis, and we use the following main criteria to determine whether or not to accept the ARC at ICS. Is it a reasonable scope? We do need to consider the needs of other submitters or knowledge users as well. Are you an eligible knowledge user? Are you a publicly funded organization who wishes to impact health in some way? Will the results inform the evaluation, planning, or monitoring of Ontario's health system? This one is critical. Your request must demonstrate this. And finally, feasibility. Can the research question actually be answered by our data? If your request is accepted, the data and analytics support can be provided from project teams across the organization, or even from one of our 6 satellite sites in Ontario. On the next slide, I'll provide examples of knowledge users who typically submit ARCs. So you can see that our submitters are often from the ministry, government, agencies, hospitals, public health units, community organizations, Indigenous partners, or other groups such as professional organizations. I will say that a portion of the ARC funding that we receive from the ministry is earmarked for requests from Indigenous partners to help them address questions about their communities. So there is a separate process altogether for ARC submitted by these groups. If you are interested in learning more, please feel free to reach out and I'll connect you to the right person. Okay, so on the next slide, I'll review some of our stats. We do accept many ARC requests every year. Since this initiative was launched at ICS over 10 years ago, we've had over 500 submissions. If you look at this past fiscal year, we've had 33 submissions, of which 26 were accepted and 5 are pending decision. Next, I'll showcase a sample of ARC projects that we've done in the past. I wanted to include examples here highlighting the breadth of topics we're able to take on under our portfolio. We're very fortunate to have access to many subject matter experts right here at ICS on a broad range of topics. And if you click on the link there below, it will take you to our website where we have listed all the projects we've done in the past. Next slide, please. So we typically provide knowledge users with an Excel document containing results. However, in an effort to be responsive to the changing needs of knowledge users, our outputs have also evolved over the years to include things such as dashboards, summaries to help with data interpretation, as well as infographics. Moving forward, I'll provide concrete examples of how ARCs have been used in the past. Our ARCs have had significant impact over the years. Of course, during the pandemic, we were able to provide regular updates to inform immediate decision-making. Our research was also used by the Ontario College of Pharmacists for deciding which minor ailment conditions to include in the expansion of scope regulation. And at a more local level, we've helped inform decision-making around keeping and expanding a virtual intervention to other regions. And finally, an ARC was accepted by our Public Advisory Council in an effort to promote transparency of the ARC process. And they're going to use their results to contribute to the development of research products for the public. Okay, next I'll go over how you can submit an ARC. Okay, so if you are interested in submitting an ARC, you would need to submit a request form. And I have the request form there on the left for you, and also included the link below where you can access and download the form directly from our website. And I've also included some tips for success in submitting your request form. And at any point, if you are interested in connecting to discuss feasibility, eligibility, or even just to learn a little bit more about the program, I'm happy to connect with you and set that time up to discuss those things. So feel free to reach out at any point. Okay. So that concludes my portion of this presentation, and I'll now hand it over to my colleague, Stefana, who will present on one of the paid streams in our department.
Thank you, Diana. Hi, everyone. My name is Stefana Joanowska, and I'm a senior project manager on the DAS team, particularly supporting public sector portfolio research at ICS. Next slide. Thank you. So prior to 2014, in order to initiate a project using ICS data, you had to collaborate with an ICS scientist. But after the stream of services was initiated, you no longer needed to meet that criteria in order to initiate your project at ICS. So starting 2014, we initiated the stream where any public sector researcher could initiate a project through Data and Analytic Services. And eligible researchers included researchers that were affiliated with university, colleges, hospitals, institutions, publicly funded, non-for-profit institutions as well as policymakers or publicly funded knowledge users. Next slide. Since we were initiated in 2014, so 10 years, we have been steadily growing, and recently we reached the milestone of 1,100 projects, and these projects have had a vast variety of topics with very different types of publicly funded researchers, and we're happy to continue this growth and support many different types of research and researchers in the future. Next slide. We offer 3 types of services through this platform, and those types of services are access to data, support, analytic support, and services and reports, and also support for cohort and longitudinal follow-up studies. I will dive into the details of these types of services later on, but primarily I wanted to familiarize you with the process by which we initiate this type of research. Next slide. So if you're interested in initiating any of these types of projects through Data and Analytic Services, primarily you will have to submit a request form that is available on our website. We review that request, and we typically organize a consultation with you to understand what your research needs are. And if we find that the project is feasible and doable with the data that we have in-house, we issue a confirmation of feasibility. The confirmation of feasibility is essentially just a confirmation that would say that, yes, we can do this research, and it also would outline the cost for the project. We thereafter ask you to obtain a Research Ethics Board approval in order to proceed forward with the project initiation process. It is important to note that we cannot proceed with initiating the project unless the Research Ethics Board approval is in place. After that approval is in place, we issue out a DAS services agreement to initiate the project and proceed forward. It's important to note that if you are interested in importing externally collected data, we can support that. And at this stage of the project initiation process, we set up a data sharing agreement to accommodate that importation and linkage. Once we have the governance stage finalized, we work with your team to develop an analytic plan. We internally refer to that as a dataset creation plan, which is essentially a plan that we develop in order to translate your research objective needs into a plan that our analysts can use and develop the cohort or analysis that you require. From there, we can provide to you the 3 levels of services, either provide you with access to individual level data, or provide you with summary level data reports, or provide you with a cohort list to meet your research needs. Now, to dive into each one of those 3 services, we can proceed to the next slide. Thank you. So the first type of service that we offer is access to data. And we can provide access to individual level data. However, this data is risk-reduced coded data, and it's available to you on either one of our 2 analytic environments. So one of our analytic environments, it's called the IDAVE, or ICS Data and Analytic Services Virtual Environment. And in that environment, you will have tools such as SAS, R, Stata, Microsoft Office tools in order to perform your analysis. The individual level data will have to stay onto that environment, but if you're interested in taking out summary level data, those can be vetted by one of our staff scientists and released to you for your publication needs, or for sharing with your colleagues, or for presentation purposes. It's also important to note that we do have another platform, which is a high-performance computing platform. It's called the Data Safe Haven. And on this platform, we have Python and RStudio, which can be made available to you for your analytic needs. It's both of these platforms can be accessed anywhere in the world. You would not require permission to access them from Canada, Australia, US, UK, and New Zealand. However, if you require access in any countries outside the 5 that I named, it is possible. Just your IP address would have to be approved, and we can make that happen for your team. On your end, if you don't have analytic needs and you would require us to support you with that, we can provide you with also analytic services and reports. And in this case, we're not going to be providing you with individual level access to the data, but we're going to provide to you summary level results. Our analyst is going to work with you to understand your research needs and to develop the deliverable in a way that would be useful to your team. So moving on to the third and final type of service that we offer. These are the support for cohort and longitudinal follow-up studies. In this case, we provide you with the identifiable cohort list. And because of the sensitivity of these projects, there is a greater process in terms of approving them from the legal and privacy standpoint. And furthermore, the only reason we approve these types of projects are the following. They have to either be for extraction and examination of the data, or they have to be for the purpose of recruitment in research. So that concludes the overview of the services that we provide through the public sector portfolio. However, if you have any questions, you can always reach out to me or directly to the DAS inbox. That is das@ics.on.ca. So in the next steps, I'm going to hand it off to my colleague, Carissa Arnold, and she will be providing you with an overview of the private sector portfolio at ICS. Thank you very much.
Thank you. Hi, everyone. I'm Carissa Arnold, and I'm the Research Project Manager for the Private Sector Portfolio. And I will now provide an overview of the private sector services available in DAS. Next slide, please. Private sector organizations and researchers with funding from the private sector will have their requests processed through the private sector portfolio. Public sector organizations with partial funding from a private sector entity are generally required to go through this portfolio as well. Next slide, please. When working with private sector researchers, DAS is guided by our public benefit requirements. So the research must align with ICS's mission, vision, and values, demonstrating an intention to improve policy and healthcare, as well as the intention to disseminate or publish the generated knowledge. Researchers must agree with our transparency principles. And as part of these principles, the client name, project title, and research objectives are posted on our website after a services agreement is signed. Also, the full final deliverable and dataset creation plan are posted on our website 12 to 18 months after project completion. There should also be scientific merit of the research. That is, there should be an intention to use the results solely. There should be no intention to use the results solely for direct monetary benefits, such as marketing and advertising purposes. And finally, the research must not detract from ICS research. Next slide, please. The services available to private sector clients include analytic services and reports, where the analysis is performed by an ICS analyst. The analytic plan is guided by the client, and deliverables are provided in the form of reports that include summary data. Interim reports are provided to the client on an ongoing basis. We also facilitate importation and linkage of external data for project use. These include data from patient support programs, clinical trial data, and other data sets. Please note that access to individual level data is not available to private sector researchers. Next slide, please. Similar to the public sector portfolio, this workflow outlines the project process for initiating a private sector project. Firstly, the requester submits the DAS private sector form, which details the project intentions. The DAS team will then invite the requester to a consultation to discuss eligibility and project feasibility. If eligibility and feasibility are confirmed, we will then provide a confirmation of feasibility that includes a quote for services. The requester will then seek Research Ethics Board approval and provide DAS with a copy of the approval letter and other supporting documentation for review by the ICS Privacy Office. DAS will then work with the requester to develop and finalize the dataset creation plan, which is then used to conduct the analysis. The requester is provided with preliminary deliverables on an ongoing basis throughout the analysis. And upon project completion, DAS will then provide the final deliverable, and within 12 to 18 months of completion, the final deliverable as well as the dataset creation plan will be published on the ICS public-facing website. Next slide, please. Private sector research projects cover a wide cross-section of health conditions and are the typical burden of illness project, focusing on healthcare resource utilization, clinical outcomes, incidence and prevalence, etc. Next slide, please. Analytic projects conducted through the private sector portfolio are often published in peer-reviewed journals. This slide provides a few examples of journal publications in areas such as various cancers, diabetes, etc. Next slide, please. Next slide, thanks. This slide just provides an overview of the different requirements for each portfolio as they were presented earlier. We're happy to answer any specific questions about the project requirements for each portfolio at the end of the presentation. Next slide, please. And as we've alluded to before, available services will depend on the portfolio through which the request is submitted. As you can see in this slide, public and private sector requesters do not have access to all the data holdings at ICS, and only public sector researchers have access to risk-reduced coded data. Next slide, please. Oh, I think we actually have a poll now, before we invite Natalie to talk about working with a DAS analyst. I think that should be poll number 4. I think it's the poll that asks about the REB. So now that we've kind of gone through the presentations, do I think I need an REB for a project that I may be interested in doing? We can probably get to that poll. Thank you. Great, thanks. And we do have more information on the REB and specific requirements later on in the session. But next, I will invite Natalie to present on working with a DAS analyst. Thank you.
Okay, there I am. Thank you for the introduction, Carissa. So now that the various portfolios have been introduced and we have a better understanding of the different types of projects that can be conducted through Data and Analytic Services and where REB approval is required, I'll be walking you through my role as an analytic epidemiologist who would be conducting your DAS project. My name is Natalie, and I'm a senior analytic epidemiologist who has been with DAS for 4 years. As a high-level overview, I provide knowledge users with access to research-ready linked administrative data and analytic tools, as well as support advice on health administrative data set creation. As an analytic epidemiologist, I'm able to help you through every step of the way, from creating the analytic plan to performing the analysis myself and providing you with the final outputs or reports. Typically, epidemiologists at ICS focus solely on creating the analytic plan, which is then passed on to an analyst to conduct the project. However, within DAS, our epidemiologists play both roles. I've had the pleasure of working on a various number and types of projects during my time with DAS that span across each portfolio that was introduced. On the next slide, I will discuss the common roles I play within each, providing a brief look into a day in the life of a DAS epidemiologist. So within third-party research, the initial steps are similar across all types of services offered. I first work with the requester to develop and finalize the analytic plan, outlining in detail the requester's data requirements, like specific data sets, timeframes, variables, covariates, etc. Here, I will offer my expertise and advice on data set creation and data availability. We also have various in-house macros, concept definitions, derived cohorts, and existing algorithms available that I may suggest including in the analytic plan to assure efficiency and standard practice. For example, we have ICS-derived cohorts for diseases like asthma, diabetes, Crohn's and colitis, hypertension, and dementia, as well as numerous macros available for my analytic use, anywhere from table creation to deriving someone's OHIP eligibility at a certain period of time, or to determine demographic or geographic information for a cohort of patients. Once the analytic plan is finalized, I'll move forward with completing your request. Each of the types of services are unique and will determine how I will provide analytic support. For third-party public sector data access projects, for example, I will create cohorts using individual level data according to the approved analytic plan. As Stefana touched on, the customized research-ready linked data will then be uploaded to a secure virtual server known as the ICS analytic environment. However, the individual level data posted to this environment must be highly risk-reduced. So this means that prior to uploading, I will perform privacy checks to confirm that the data does not contain frequencies of quasi-identifiers less than 3. In general, a person's age, sex, smallest location, and shortest time point will need to be included in my privacy check. So for example, if age and sex were the only quasi-identifiers in your dataset, we would have to ensure that there is more than 2 people within each age and sex combination that appears in your data. I typically do this alongside cohort creation so the requester can anticipate what their data will look like, as it's possible we might need to modify how the data is presented if there are any frequencies less than 3. So for example, if age was originally requested to be presented numerically, but we're unable to do so because of privacy issues, then I will confirm with the client the age brackets we are actually able to provide. Using more of a specific example, if there were hypothetically 2 females who are 20 years of age in our cohort, this would unfortunately not pass our privacy standards when age and sex are both included as quasi-identifiers. I would ultimately need to categorize age, possibly using 4-year age groups like 20 to 24. So I ultimately work hand in hand with the requester to try and provide individual level data in the structure that best reflects their research objectives while meeting all of our privacy standards. Alternatively, for third-party analytic and reporting projects, not only do I create the cohorts according to the analytic plan, but I also generate the research deliverables such as tables, figures, or reports. Here, I still work with the individual level data, but but the data itself does not have to be risk reduced, as the clients will not have access to such information as the other presenters touched on. Rather, this time, all output in the deliverables or reports must be risk cleared prior to release. So this entails suppressing all cells with less than 6 observations, including any adjacent cells to avoid back calculation. However, I will again work with you to provide meaningful output that best reflects your research objectives. Examples of third-party projects that I've worked on and have published alongside the requester include topics from how the COVID-19 pandemic impacted diabetes care for adults with type 2 diabetes to the use of metformin in overactive bladder. Furthermore, the steps for me to conduct an ARC project is similar to that of a third-party analytic and reporting project, but rather with a focus on system evaluation, as Diana highlighted. Although instead of working directly with the knowledge user, I typically generate the deliverables according to the analytic plan designed by an ICS scientist. Since ARC knowledge users can include organizations with little to no analytic background, together with the ICS scientists, we use our expertise to create an analytic approach that best responds to answering your applied health research question. Examples of ARC projects that I've worked on include topics related to COVID-19 testing amongst vulnerable populations, as well as differences in healthcare utilization, costs, and outcomes for patients using virtual care services versus ED visits. So next slide, please. Overall, ICS data provides the flexibility for me to link individual records across a large breadth of data to be used for a wide variety of topics. Hopefully, I have provided you valued insight into some of the behind-the-scenes operations of a DAS project, and if you ever choose to work with DAS in the future, it would be my pleasure to help conduct your research. I'll now pass it off to Michael, who will speak to the privacy and legal obligations when working with DAS. Thank you.
Thanks, Natalie. Okay, well, thanks everyone for joining us today. Michael Smith, and I'm the Director of the Privacy and Legal Office, of which Privacy Services is obviously a central part. And I'll be talking to you today about some of the things that Privacy Services does and the types of things that we look for when determining whether research ethics review and approval is needed. If you can go to the next slide, please. Okay, so our Privacy Services unit is currently made up of 3 individuals. We have 1 privacy manager and 2 privacy analysts, and we're all overseen by our Chief Privacy and Legal Officer. We also have 2 new analysts joining us in about a month's time, which is great news for us. And we have a few different core functions. First and foremost is our privacy impact assessments. So we review and assess PIAs for ICS data holdings. So that's when we're bringing in new data for kind of wide use. We have our ICS projects, so projects that are led by principal investigators that are from ICS or that are overseen by a responsible ICS scientist. We have third-party research projects, both public and private, which my colleagues previously spoke to. We have those applied health research questions, and then any kind of business process or technology that can involve identifiable information or impact identifiable information. Those are subject to PIAs as well. We're obviously a busy little shop. The PIAs that we do on an annual basis number into the high hundreds, sometimes even over 1,000 in a given year. So it's quite a bit of privacy review. In addition to those privacy impact assessments, we also investigate any kind of suspected or confirmed privacy incidents, which are thankfully not too many. And then any kind of advice or consultations, whether internally or externally, we provide any kind of subject matter expertise related to those questions. Okay, if you could go to the next slide, please. Okay, so in order to better understand how we do the work that we do, so things like our analytics or research projects, our ARC projects, or providing data access to third-party researchers, it's important to understand what our role is as a prescribed entity, and what that role means in terms of how we function and how we interact with Ontario's Information and Privacy Commissioner. So ICS is a prescribed entity, or a PE, which is a status that's designated under law. We currently hold 2 designations as prescribed entity under both the Personal Health Information Protection Act, or PHIPA, and the Coroners Act. So what that means from a functional perspective is that a prescribed entity status under PHIPA allows an organization like ICS to collect and use personal health information without individual consent or research ethics approval if that collection or use is for purposes related to evaluation, planning, or monitoring, which at ICS we usually refer to as EPM or analytics of the health system. So if we're looking at better understanding the health system, if we're looking at improving the health system, things like that, we're permitted to collect and use that personal health information. Similarly, under the Coroners Act, it's essentially a same purpose, kind of that evaluation, planning, or monitoring for personal information, not personal health information. And the scope is slightly broader. Instead of the health system, it's related to the health or safety of the public. So obviously our ability to collect and use identifiable information without that individual consent and without that ethics approval is an enormous privilege and enormous responsibility. And what that means from a practical perspective is that we regularly work with Ontario's Information and Privacy Commissioner. We submit for approval various policies, procedures, and practices. We're also required to provide what they call indicators, which is basically a large set of statistics over the course of a 3-year period that reports on the way that the organization is functioning, how many types of privacy reviews, and many other things like that. We are reviewed by the Privacy Commissioner on a triennial basis to make sure that our operations are upholding the security and the confidentiality of the data that's under our stewardship. If the Privacy Commissioner has any findings, any formal recommendations, those findings are made publicly available, both on our website and on theirs. And it's important to note that this prescribed entity status can be revoked if an organization was not fulfilling its responsibilities for privacy and security of data. Okay, if you can go on to the next slide, please. Great. Okay, so the question that we get quite a bit related to research ethics board approval is, of course, why do some projects require REB approval, and why do some not? How does this work, and what are the considerations that need to be factored into our review? Now, this can be a bit of a complex question. There's lots of different factors to consider, but for the purposes of what we're talking about today with data and analytic services, third-party research, things like that, I'm going to kind of look at it from that perspective. So the main factor that we would consider for that type of a project or those types of projects is who is doing the project that's actually using the ICS data. So the important distinction here is that the prescribed entity status I referred to earlier ago, it permits us to collect and use personal health information or personal information without consent or REB approval if it's for that evaluation, planning, or monitoring purpose, but it doesn't permit disclosure for that purpose. There are a few exceptions to that rule. If we were disclosing information to another prescribed entity, for example, we could disclose it for that purpose because then they would be collecting and using it for that purpose. But when we're talking about things like third-party research or applied health research questions, we don't have that opportunity to disclose for that evaluation, planning, or monitoring purpose. And what that means as a result is that that information can be disclosed to third parties, but there are kind of limited avenues for disclosure. The one which is obviously the most appropriate is a disclosure for research. And because it's a disclosure for research, it requires a research plan that's reviewed and approved by a research ethics board. So to give you kind of a clear example of what I mean, so different types of projects that we do. So for an ICS project, so a project that's led by an ICS principal investigator, if it's conducted for a purpose related to evaluation, planning, or monitoring, no REB would be required. If it's an applied health research question using ICS data for a similar purpose, where we're only providing de-identified outputs to the knowledge user, because it's ICS using the data, no REB is required. And then any kind of third-party research where there's data disclosed by ICS to a third-party research, REB would be required. And you can probably put a big asterisk next to all of those examples because that's generally the case that REB is not required. If we're talking about a project that is just using ICS data, no REB would be required. But of course, lots of projects both at ICS and externally are interested in using external data with the ICS data. And depending on what the external data is and our review of that, it may be the case that REB review is required in that scenario. So if we can go to the next slide, please. So another common question we get is about projects that are using external data. So using ICS data, but also bringing in external data from another source. And what are our key considerations that privacy services is looking at when we get a request for a project that is using what we call project-specific data, but that's data that we're bringing in for a singular project purpose. So any kind of analytic or research projects that are requesting project-specific data or PSD that are to be linked with the ICES data require a bit more of a specialized review and assessment by our privacy services team, because we need to determine if we have a legislative authority to collect and use and disclose that data. These authorities can be dependent on a few different factors. Some of the more relevant ones or notable ones are firstly, what's the purpose of the project? Is it a project that actually aligns with evaluation, planning, or monitoring of the health system, or is it more accurately conceived of as a research project? What's the nature of the data? Is it identifiable information like personal health information or personal information? Is it de-identified, meaning it was identifiable at one point, but it's been made de-identified? Or is it non-personal, something like weather or environmental data, something like that? And importantly, are there specific variables in the data that maybe by themselves wouldn't be identifiable, but when you start building those little pieces of information together, is that potentially inadvertently identifying someone, in which case we would need to classify it as identifiable data? And then lastly, and this can be a bit of a challenge to determine at times, is who is actually the custodian of the data, which is to say who has custody and control of the data. How did the data come into their possession? There are times where control of the data might belong to an individual researcher within an organization, or it could be under the control of the hospital in which the researcher works at, for example. Typically, a question that we ask, which is helpful, is what would happen if the individual actually left? Would they be able to take the data with them, or would it stay with the organization? If it stays with the organization, it usually means that it's the organization that actually has control of the data. And then, of course, is that type of organization, whether it's a hospital or a research institute or something different, is that actually contemplated under the Personal Health Information Protection Act or the Coroners Act, or is it something considered under a different piece of legislation that we would have to familiarize ourselves with? And I believe that is it from the privacy perspective. If you can go to the next slide.
Thank you so much, Michael, and thank you to all the presenters so far. A lot of information I know we've sort of thrown at you. I do see some questions already in the chat, and I'm going to pick on Natalie to get us started to answer some of these questions. So for the first question, it's for the diabetes data set. Is that just for adults or children as well?
Yeah, so the Ontario Diabetes Database that we have available at ICS contains all individuals in Ontario with any type of non-gestational diabetes. So we can't distinguish between type 1, type 2, or other type of diabetes, but this includes all ages. We do have different case definitions for pediatrics versus like the adult definition, but it does include everybody, so that's good. Mm-hmm.
Awesome. And the next one, do we need to develop an algorithm to develop data of patients with a specific disease we are interested in?
So for third-party projects, we typically do ask our clients to provide us with definitions, including all of the diagnostic codes, procedure codes, OHIP codes, along those lines to define all diseases, unless we have that information available at ICS, like the comorbidity cohorts that I touched on, like asthma, hypertension, et cetera. We do have some like additional algorithms available that are not necessarily in a derived cohort already, but for ARC projects where the knowledge user might be not very analytic, we we will obviously help you create some definitions, and we also have lots of good resources of reaching out to scientists at Sunnybrook or whatnot. So yeah.
Thanks, Natalie. And then it kind of segues into the third question, I think, which is related. Is ICS data set comprehensive? I mean, do you have information on all types of disease?
I think we have a pretty good variety, but I guess it might necessarily include something specific you're looking for. So I guess that might be another question that we can maybe follow up with if the question is something related to a specific disease. But yeah, I think we have a pretty good base to cover for diseases and available algorithms and derived cohorts here at ICS. So.
Thank you, Natalie. And I'll just add on to Natalie's point that we do also have a really large data set that looks at the lab tests across Ontario. So that is one way that we sometimes use to help define certain diseases or disease cohorts or treatment cohorts. So I think the short answer, and Natalie's covered it quite well, is that, come talk to us because we probably don't have everything. Oh, that's a good one. Yep, obesity. Yeah, thank you, Jacob. I don't know if you want to elaborate on that one, Jacob, a little bit more, but there's certainly, we don't have everything on everything. But we do have a number of our derived cohorts that are validated as well. And so that's why they sort of sit in our regular section of, validated disease cohorts. But we're happy to work with, people that come to us with different questions. Okay, there we go. Thank you, Mike. Yes, we also have a data dictionary of what's available on our website. You can get a better understanding of the types of data we have. The one piece I will mention is that Carissa, when she presented sort of that summary slide, there are some data sets that are only available to third-party researchers versus questions that come in through the applied health research question. And there are reasons for that. But to get started, if you are interested in certain kind of data sets or types of data that we may have, I would certainly encourage you to go to the data dictionary to take a look first. It's like the Academy Awards are playing the music, telling us it's wrapping up. Thank you everyone for joining us. I just want to kind of wrap this session up by saying that I hope you learned something today. Hope you have a little bit more information than you had when you started. Please contact us if you have any questions whatsoever. And then to put on my little communications hat to wrap up the session before lunch break. I hope everyone enjoys their lunch break. There is a lunch room or a little virtual lunch room where people can gather and hopefully connect with your colleagues. And then I also invite you to return at 1 p.m. To see our keynote. So thanks everyone for participating today and for spending time with us. And I wish you a good rest of the day.